Good afternoon to you all. Welcome to episode 2 of the BULOZI Podcast. I hope you liked the first episode, which I recorded with Dr. Majok, but this one I'll just be alone, you and me conversing about pregnancy. So, episode 2 of the BULOZI Podcast. My name is Blessing Jozi, but I'm known as Dog Bulozi on my socials, right? On all of my socials. I'm a medical person who just graduated. I graduated last year. I studied in Russia, but now I'm currently in Zimbabwe, in the city of Bulawayo, doing what's called orientation, where you are orientated to how things work in Zimbabwe, in my country, which is 6 months, non-paid, and I am enjoying it. So, if you want to look for me on my socials, I'm known as Dog Bulozi on my TikTok, DOC_BULOZI, right? If you want to find me on my Facebook, Blessing Jozi, my name is there. Or you can look for my page, which is also known as DOC_BULOZI, Dog Bulozi page. On Instagram, it's the same as my TikTok, DOC_BULOZI. That's for my Instagram. I post every day medical information, medical advice. You can DM me, text me. My numbers are even up there. Plus also, but Saturdays I don't post. I just post these podcasts. Okay. So, and I have exams end of this month in a few weeks. So wish me luck. Now that is out of the way, let's continue with the topic of the day. So today we're talking about pregnancy. I'm not going to delve into all the other symptoms. I wouldn't call them symptoms, okay, signs of pregnancy, which you probably know: nausea, vomiting, cravings, fatigue, and all these other things. Not those ones. I'm talking about someone who's pregnant and things which will happen. And as ladies, they're a bit more sensitive to certain things that happen, right, in their body. So I would like to put this in the light so that when it does happen, you do know that, oh, this is a normal part of pregnancy. So I'll start with one, which is most visible to the whole world: dermatologic, meaning your skin, right? You're going to have some skin changes during pregnancy. And the most common one, which is even at the start, is called linea nigra. One of the ones I did not talk about. It's a line which forms here on the abdomen, right? Linea nigra, and it's very visible. Sometimes it forms later, but it's there. Then as for what can be seen on the face, right, you're going to have some brown pigmentation, usually towards the end of your pregnancy. It's because of a rise in the hormones, estrogen, progesterone, and something called MSH, melanocyte stimulating hormone. It's related to skin function, right? So you're going to have something called melasma, which is called the mask of pregnancy, where it affects your forehead, right? It also affects the malar areas. These areas, you'll see dark brown spots there. It will happen. Then we also have darkening of your areola, right? Around your nipple, it's going to darken. Your armpits could darken, right? Also, your genitals could darken. That's quite normal. So don't be scared and wonder something is wrong with you. Nothing is wrong with you. Also, yeah, we're going to have something called spider angiomas, which look like these little vessels which are spread out with sort of legs like spiders, usually above the waist. You see one or two. And also in your lower legs, right, you might see some capillaries which are very visible on the surface. That's also part of the normal part of pregnancy. Plus striae gravidarum, which is just a fancy term for stretch marks. You definitely get them. Yeah. Though some people might not. I've seen people who are pregnant without stretch marks, which is incredible. Yes. Okay. And as for the melasma, you might be wondering, it goes away after about a year. It regresses on its own. The brown spots on your skin, it's more prominent in the light-skinned, definitely in white people, more prominent in the light-skinned. If we're talking about black people, it's quite more prominent. But even in dark people like me, I'm medium dark, I would say, or they're really dark people, but you will still see the spots. They'll still be present. So that's number one. Now, I was putting it in order of what will affect your life or something which can be important for facials and so on. So going on to number 2, I'll talk about the gastrointestinal system and the hepatobiliary system. So that's just fancy words for your digestive system. When you eat, food goes down, whatnot. Since the uterus is getting large, right? We're getting a large uterus here. The baby's in there, it's growing. It's going to compress your organs, right? Most importantly, it's very close to your rectum. It's going to compress that. So you might see that you might have episodes of constipation. That will definitely, most probably happen. Constipation, and it's going to press on your bladder too, where you store your urine. So you might see that you are going to the toilet a lot more frequently. Wait, now I'm diverting. Sorry, I was not diverting. So we're talking about constipation, right? And also because of progesterone, right? One of the two main hormones in any lady, in any female, right? We have those two hormones, estrogen, progesterone, right? They are very abundant during pregnancy. So it's going to reduce your gut movements, right? Which contributes to constipation. Then we have heartburn and belching, right? They're common because of delayed gastric emptying. As you might understand, the uterus is growing big, so it's going to press on your organs, not so much movement. Plus, already I did mention progesterone decreasing your gut movement. So it's definitely going to, it's going to happen. So you're going to belch a lot, heartburns, it might happen, don't be scared. Acid production goes down. So if you have an ulcer, you might realize, or if you were pregnant before, you realize that your ulcer pains or your ulcer problems got a bit better during pregnancy. It's because it's because acid production goes down during pregnancy. Yeah, and also we have an increase in the disorders which affect the gallbladder. Nduru in my language, which is behind the liver. Problems can arise, they easily arise in pregnancy compared to non-pregnant people. Also, you might have hemorrhoids, right? Because the uterus is pressing on your blood vessels on something called the vena cava, which is the main largest vein in the body. It moves blood, right? It's a vein. So when it's pressed by the uterus, blood is going to pull down here, right? Because you understand it's pressing. So blood is supposed to be moving up, going back to the heart from your legs, but it's caught up there. So what will happen is that, it's caught down there. So this is the area, front, back, legs. So you might have hemorrhoids. Hemorrhoids is basically just dilated blood vessels usually. Yeah. So that's going to happen too. Plus a bonus, you're going to have increased salivation during pregnancy. So, hope you got that. Let's move on to number 3, respiratory system, which is just fancy term for your breathing system. What's going to happen is that your lung function is going to change, right? Due to hormones and due to the growing size of the uterus, the womb, right? So what's going to happen is the uterus, as it's growing, is going to press on your lungs. It's going to move up and up, right? It's said that even in the last stages of pregnancy, it presses on your xiphoid process. So this is my sternum. It's a bone which is here. Well, you can't hear the knocking, but there's a bone here, right? It has like 3 parts, if I remember well. I didn't study them, forgive me. So it has the top part, which is just here, about 1 or 2 ribs. Then we have the manubrium, the main body. Then we have a xiphoid process, which is here, right? It's part of the anatomy, part of the structure of the bone. So it's said that the uterus will go up to your xiphoid process here. So you can imagine somewhere here. It's pressing on your lungs. You can't breathe much. So you're going to have you might have breathing issues, which is why we don't usually recommend a lot of exercise during pregnancy. Like intense exercise is not really recommended, not just for your respiratory, even for the child too. It can be problematic, especially if you have had other problems like cervical prolapse, or maybe you have a weak cervix, right? Your exercise is vigorous. It's possible that it could burst and you have premature conception where the baby comes out before their time. Okay. So progesterone, I'm always going to be talking about progesterone. It tells your brain to lower the amount of carbon dioxide. So to do that, breathing has to go up and the plasma pH has to go up. Plasma is just a component of blood. So that pH, right, which is the amount of H plus ions, hydrogen ions, the acidity, right? Your plasma pH goes up, meaning it becomes more alkaline, right? When pH goes down, it's acidic, goes up, alkaline. The opposite of acidity is alkalinity, if that's a word. Yes. So, plus also oxygen consumption increases. Oxygen needs increase, right? During pregnancy. That's why you might also be breathing more, because you need oxygen for your child. You need oxygen for the placenta. The placenta is sort of like the medium between the mother and the child, right? It's in the womb. Usually it's passed right after giving birth. The placenta goes out, right? So that part, it has a lot of blood vessels, and well, like I said, it's a medium between the child and the mother. So it also needs its own oxygen, which is major. Because, right, if you drink or smoke, there's a probability that your placenta reduces in size. And when that happens, your child won't get enough blood, won't get enough food, won't get enough oxygen. And you might have a child who is little, who is not as big as he's supposed to be. Which is why drinking and smoking is not recommended. Though drinking, if we're really to look into it, you can drink actually, to be truthful, well, medically speaking, but it's such a low amount that, if you were to start drinking, probably you're just going to drink more than you should. So that's why I personally would not recommend you to drink at all during pregnancy. Smoking, completely off. Do not do that. Then also the thoracic circumference. So the circumference of your chest increases. It happens. And also we're going to have possible edema. Edema just means there's a lot of fluid gathering inside your lungs. So breathing becomes problematic. And there's also hyperemia, meaning a lot of blood is pooled. Or blood is pooled to your lungs, which can be problematic with breathing too. So mild breathing problems are very common in pregnancy and they're very frequent. So that's number 3. Now let's move on to number 4. The urinary system changes during pregnancy. With the urinary system, what's going to happen is we have something called glomerular filtration rate. It's the rate at which the kidneys filter your blood to make urine. So if you're pregnant, the rate goes up. Your kidneys are working more, right? So that's what happens. Then towards the end of pregnancy, it slightly decreases, but it's still high compared to a person who is not pregnant. So when that happens, that means there's going to be more urine production, number 1. Number 2, there's a test called U&E, urea and electrolytes. Probably you might have had it done if you are diabetic, right? It's to find the function of the kidney. So if you had to do that test whilst you're pregnant, you might see that the components there might be a bit deranged, not in the normal space, right? In the normal range. Exactly, range is the word I'm looking for. In the normal range, and that's quite okay. If you're pregnant, those things change, and that's quite normal. It doesn't mean you're sick, right? So also what I talked about before, when I was talking about the gastrointestinal system, or the gut, the digestive system, I talked about the uterus pressing on your urinary bladder, right? This is where it's important. It's getting big, it's pressing, so you easily go to the toilet. Always going to the toilet most of the time. So that's important. Uterus grows big, presses on your bladder, which stores urine. You go to the toilet more. Important to know. Then also, what else? So hormones, right? Hormones. I'm going to always talk about hormones because they're very important during pregnancy. They're going to make your ureters bigger. Ureters transfer urine from your kidneys to your bladder where it's stored, right? They're like these long tubes. So they get bigger, right? Also because the uterus is pressing on your bladder, right? On the storage of your urine. So you might have some kind of backflow where the uterus presses on the bladder. There's some backflow of urine up those ureters back to the kidney. So they get larger so that they can, work against that. And to avoid possible hydronephrosis. Hydronephrosis is where we have blockage along that ureter and urine basically pools in the kidneys and they get much larger. So we want to avoid that situation. That's why they also increase in size. Yeah. To avoid that backup. Then what else I want to talk about? The position also. Your position, sleeping position, standing position, they all affect urine production, right? So you might see that if you lie on your back, like really you lie on your back straight, urine production is going to go up. So you will urinate more. But when you are standing, production of urine goes down. So you might see a day you're standing and a day you're mostly lying down. You see that when you're lying down, you're likely to go to the toilet more than a day you're standing most of the time. And also the lateral position, where you lie mostly on your left side, right? Lying on your left side, is very favorable for production of urine. It increases the amount of urine produced. It makes you go to the toilet more, right? And is the reason why when you're about to sleep, or when you're sleeping, you'll see that you will go to the toilet more. because you're lying on your side, which increases production of urine. But also important, right? Important to know is that now I'm lost. I forgot. I knew what I wanted to say, but now it's out of my mind. Hopefully it will come back. All right. Yes, exactly. So the uterus is going big, pressing on your vessels. So it's not recommended to sleep on your back directly when your womb is now quite big, because it's going to press on your vena cava, which I talked about, right? The largest vein in the body. It's going to reduce blood supply to your child, causing problems. So it's always recommended you lie on your side, never on your back flat. Remember that. Then that's number 4. Now we go on to number 5, blood. Blood is also going to be affected in pregnancy, right? The amount of blood generally increases in your body to accommodate your child, and the placenta, which I mentioned also. So blood production goes up. Then also another component of blood goes up, which is the general amount of blood increases, right? But more specifically, something called plasma goes up. Plasma, it's a component of blood. It goes up more than the red blood cells. The red blood cells are the ones that transfer oxygen. So plasma, red blood cells, kind of different. So plasma goes up more than red blood cells. And this dilutes something called hemoglobin. Hemoglobin is responsible for carrying your oxygen, right? That's why you see that. Okay, I was about to mention something for medical doctors. Okay, so anemia classification. Anemia, reduced amount of blood in the body. The classification of anemia in pregnant women is different from non-pregnant women. This is one of the reasons, because your hemoglobin is diluted and therefore it goes down when it's recorded. So we have to, when we are measuring anemia in pregnant women, it's a bit lower, right? The class is a bit lower because of this reason. One of the reasons. Yeah. So moving on, your white blood cell count is also going to go up. So white blood cells are responsible for fighting infection in the body, basically. So they're going to be higher than normal usually in pregnancy, and it does not mean that you have an infection. It's just the way it is. And during labor and just after, a few days after giving birth, it will really increase, right? It can get up to 12,000 cells. 12,000, 12,000. Just remember the number. Oh, the number is not really important, but it will really go up. And it's quite common during labor and a few days after giving birth. Okay, so your iron requirements are going to go up. That's why pregnant women, it's recommended that they take supplements, right? And someone might ask, why can't I eat all the iron I need? Why can't you do that? Well, it's important to note that iron requirements go up in general, but in the second half of pregnancy, it goes up much higher. The requirements go up much higher, right? And remember, it's the body, you can only get iron from eating, right? When you eat, plus the body stores, which are replenished by eating. And you have to understand that a lot of things need iron in the body at this point. Your child, the placenta, and blood, the blood of the mother. And I said blood generally goes up. The amount of blood in the body of a pregnant woman generally goes up, meaning you need more iron, right? Plus, some of it is excreted, meaning it's removed from the body. Even if it's unused, right? It's like when you eat, you don't necessarily use up all the food, because sometimes some of it isn't. You don't use up everything you eat. Some of it might be excess and just goes away, right? Not a lot of it, but so this is the concept, right? Not everything you take in is going to be absorbed in the body. Something to note. So yeah, supplements are needed because the diet and iron stores sources are usually insufficient. Most of the time they're insufficient. Increased blood, increased needs, your child, the placenta, more blood. Yes, it's a whole thing. So that's why I recommend pregnant women to go on iron tablets, right? Now we're moving on to number 6, which is the cardiovascular system. Generally the heart and blood vessels. Going to be a lot of changes, right? Your heart is going to beat much faster. Your heart is going to produce more blood. Something known as cardiac output goes up. Cardiac output just means your stroke volume times your heart rate. So let me explain these things. Heart rate is the number of heartbeats you have in a minute, and stroke volume is the amount of blood your heart pumps out in a minute. So you multiply these two, you get cardiac output. So this increases, so it means your heart beats faster, it beats harder. So that's why you might, if your pulse is measured when you're pregnant, it's going to be generally high. It's quite okay, it's normal. All right, then what else is important about the cardiovascular system? Plus, also I talked about increased amount of blood in the body, right? The uterus, the womb, it has a lot of blood vessels, placenta, a lot of blood vessels. So the heart has to accommodate that, and that's how one of the ways it accommodates, right? Okay. Also, your body needs to cool down, right? A lot of processes are happening in the body, metabolism taking place. So for your body to work properly, what it needs to do is maintain body temperature, and some of the blood is needed there. So that's why that's one of the reasons why your cardiac function increases. Plus also your kidneys are working overtime. I did tell you that something called GFR, glomerular filtration rate, goes up during pregnancy because your kidneys are working more. So your heart has to compensate too. Exercise can be very demanding because the baseline heart rate, the baseline cardiac output is already high, right? So when you start exercising, it's already high, right? Okay, let me explain this concept. So athletes, right, they have very high cardiac outputs, but their heart rate is quite low. Heart rate is very low. They compensate with increased stroke volume, meaning the amount of blood pumped in a minute is high, so the heart rate goes down. So that means this is normal resting athlete, exercising athlete, really hard exercising athlete, right? Then we have the normal person who is a bit here compared to the athlete, right? Because they don't exercise much. So this is the space they have to for the heart to work during exercise, right? Let's say this is the maximum the heart can do during exercise. So athlete is here, he has all this space to get to. Normal person is kind of here. Now if you're pregnant, you're already somewhere here. So when you exercise, it's a small distance to get to the maximum functioning of your heart, and that can be problematic. So that's why we don't recommend intensive exercise during pregnancy, but a little exercise is needed. Some exercise, yeah. So I didn't delve much into that on my research, but as I remember from my medical school days, we don't recommend intensive exercise in women, in pregnant women. Then we also have added heart sounds, which can be abnormal if you're not pregnant, but they're just added heart sounds known as functional murmurs. Sounds I was about to say some word I shouldn't say, but yeah, functional murmurs, added heart sounds, which are normal. Also, your heart is more horizontal. If we had to do an x-ray during pregnancy, which is not recommended because there's radiation involved, but if we were to, you see that your heart is more horizontal, right? So usually your heart is like this. When it's, your heart is, now I'm about to start lying. Okay. So your heart usually should not be horizontal, right? Your heart is more like this. Yeah. So it gets more horizontal during pregnancy, right? And it rotates to the left. And there's an increase in transverse diameter, meaning your heart gets bigger. I already talked about cardiac output increasing. So obviously your heart is going to get a bit bigger, which is expected. So yes. Yeah. Lastly, we're almost done for today. Endocrine system, the last one. So endocrine just means hormones. Progesterone, estrogen. We also have something called beta HCG, human chorionitropic gonadotrophin. Okay, let's call it HCG because I just forgot the pronunciation. Human chorionic gonadotrophin, exactly. It's the hormone which, if you had to test for a pregnancy, is the hormone they test for, right? So the important things to know which are related to hormones during pregnancy are that, right, your placenta is going to produce a lot of hormones. It replaces some of the production which should be done by other organs in your body. And also, right, we have most hormones circulate as, okay, this is not really important. But for you guys, right? I would say, yeah, just you need to remember that in terms of hormone function, there's an organ here called the thyroid. The thyroid. So its function is going to increase during pregnancy. It's to be expected, right? It's to be expected because it generally produces hormones which makes the body more active. It about metabolism of the body is generally controlled by this thyroid, right? That's why you see that in some people where it's overactive, the thyroid is overactive, they might start getting skinny, they could start sweating a lot, and so on, depending on the function. Is it getting hyper? Is the functioning getting really high or really low, right? You've seen people with goiters here and that they have certain body changes. So that's going to affect your thyroid is going to be affected. It's going to go into a net positive. So we're going to have hyperplasia, meaning it's going to get a bit bigger, and there's going to be increased blood supply to that thyroid because it's important for maintaining metabolism during pregnancy. Plus, moderate enlargement. So you might feel it a little bit that it's there, but it shouldn't be a problem. It should be problematic where it gets really, really big. That can be a sign of other illnesses. So so the things you can expect, right, because of this thyroid change, you can expect tachycardia, meaning your heart rate goes up. You can expect palpitations, you feel your heart beating. It can be expected, and excessive perspiration, you sweat a lot. That can also be due to the function of the thyroid, which produces thyroid hormones, and also emotional instability, where that's why pregnant women, to some extent, are more emotional because of the thyroid function, which has gone up, right? It's because the thyroid, this organ, is responsible for emotions too. The hormones it produces affect emotions. So that's why I see people with diseases of the thyroid can have emotional issues. So and also your body gets less sensitive to insulin, right? It gets less sensitive to insulin. That's why diabetes can be a problem in pregnant women. And also, if you already had diabetes, your diabetes can get worse during pregnancy because of that. So, yes, that's the end of the show. Thank you for tuning in. I hope it really helped. A lot of things you might have known, a lot of things I might not have known. But if you are a general listener, not really in the medical field, probably you didn't know most of these things. You might have experienced them when you're pregnant, but now at least you know that it's normal and what is abnormal, and when you need to go to the hospital. So this is Doc BULOZI. Thank you for tuning in to episode 2. Have a great day. Later.